It is said that, to put it very mildly, the degree of severe malnutrition or degree of malnutrition in Pakistan is nearly equal to that in Africa. It is said that after every 20 minutes, one woman dies due to pregnancy-related complications. And out of every 1,000 children who are born, 95 of them die before they reach their first birthday. Pakistan is a developing country of the world, and like any other developing country, the worst affected social sectors are health and education. When one works at the grassroots level, one realizes that it is a very unfortunate situation. Hope started working in the health sector initially when we first started, and then we diverted off to education as well as health. Now, basically, the health concepts of Hope cater to mainly preventive health as well as curative health. We work towards antenatal care, that is, pregnant mothers should receive, and interventions at the time of delivery, that is, if the mother needs any surgical intervention, we try to provide that surgical intervention, precisely cesarean section, in a very safe and clean environment. Right now we are running 4 health facilities, one in Karachi, one in Thatta, one in Hub and one in Sajawal. Except the Karachi hospital, which is an urban area, the other 3 are located in remote rural areas. The Karachi and the Thatta hospitals, they all have inpatient facilities, they all have operation theatres, blood bank, and all these hospitals have laboratories which work 24 hours. We have X-ray units, ultrasounds. Basically, all these hospitals are what we call secondary health facilities, and besides these hospitals, we have primary healthcare centers. Primary healthcare centers where we have simple immunizations, lady health visitors said simple illnesses are treated, and these are known as maternal and child health centers. And then we have these secondary care centers, and our basic concept is that these secondary healthcare centers should be located or should be distributed all over in different areas in Pakistan, so that there is less and less load on tertiary care hospitals.
असी नंदली खणी आयासीं बीमार हुई 6-7 ॾींहं थी वियासीं जिला बदस्तन में ई हाल थी वियसि बसि खणी जो दवा लाइ ठाही बुखार आयो त दवाऊं ववाऊं विधियूंसीं उते बुखार छॾे वियोसि वरी जो दस्त उल्टी थियोसि पोइ वरी जो खणी आयासीं हिते मकली ते चऊं त हिते दाख़िल करियोसि पोइ हुते दाख़िल कईसीं पोइ हुन दाख़िल कई नी सां सुई दवा थिएसि पई हाणे जहिड़ी करे खासी असां ॾिठो हाणे मरे खामखा चयोसि मरी कुंडी जा कीअं तंहिंखां पोइ खणी अस्पताल ते भॻासीं असांजो मतिलबु अलाह साईं हुते फ़ाइदो ॾियो आया पोइ नक में नलियूं पोइ जो खाधो पीतो कोन थियो खाधईं पोइ नक में नलियूं नलकियूं पोइ उन जे वसीले खीर वीर पे पीतो ॿार जो सभु कुझु मिले पियो चॉकलेट बि मिले पियो खीर बि मिले पियो खाधो पीतो असां जेके बचनि सां गॾु उनखे बि सही पियो मिले हिते असांखे जो ईअं बि मिले असांजो ख़र्चु कोन्हे ख़र्चु हिते असांजो को बि कोन्हे ख़र्चु सभु डॉक्टर ॾिया आहिनि
यहाँ पे वही लोग आके हमारे पास स्टे करते हैं जिनको बिल्कुल ही कोई आसरा नहीं होता कहीं से उनको यही जवाब दिया जाता है कि भाई हमारे आपका बच्चा अभी ट्रीट नहीं होगा आप उसको ले जाओ कराची ले जाओ तो यहाँ ऐसे बच्चे हम रख के ट्रीट करते हैं काफ़ी मतलब ये है कि सजावल हो गया जाती केटी बंदर बघाड़ यहाँ से तो मतलब तकरीबन ये है कि 100 किलोमीटर उसके फासले पे बहुत दूर से आते हैं बिल्कुल रूरल साइड के लिए ना वो वहाँ ये कोई फैसिलिटीज़ नहीं होती है उनको मतलब कोई अवेयरनेस नहीं होती नहीं उनको ये पता होता है कि आया बच्चों को वैक्सीनेशन करनी चाहिए कोई भी उनको पता ही नहीं होता इवन ऐसे केसेस भी चाहे जिनको पोलियो के ड्रॉप्स भी नहीं मिले वहाँ पे बाकी ये है कि मोस्टली 2 ईयर्स तक 2 ईयर्स से 15 मंथ से 1.5 साल के मतलब इस टाइप के बच्चे हमारे पास बहुत ही एडमिट हुए यहाँ पे
In Pakistan, malnutrition is a major problem, and nearly 40 to 45% of children under 5 years of age are malnourished. And if children are malnourished, they get exposed to different illnesses. Actually, poverty is a precursor of malnutrition, and then lack of awareness. Now, to combat against malnutrition, Hope has been working very closely with UNICEF since the past 2 years. and we are basically working in the interior of Sindh, in the rural areas, precisely Dadu, Shadatko, Chatta, and even the flood affected areas. We worked in Bateen and Sangha for malnutrition, and per se in Karachi we screen children as well as pregnant and lactating mothers for malnutrition by just taking their mid-arm circumference. And when we find that these children are malnourished, we provide them with specialized diets which are provided by UNICEF and the World Food Programme, and these are known as plum peanuts and uni mix. And we have a very extensive network, because in all 3 or 4 districts we have 3 teams which go simultaneously. Until date, in 1 year, in each district we have covered nearly 120,000 children and nearly 80,000 mothers. So if you multiply it by 3, you can realize how many children and mothers we have screened and we've covered, and 50% of them are malnourished. And our team, comprising of doctors, health workers, social mobilizers, go to areas which say are, if it is Dadu, then like they are 2.5 to 3 hours from Dadu. We travel every day, go to the villages, see these malnourished children, provide them with the diet, and then explain to them, counsel to them, and come back after 15 days, again give them the diet, and it goes on. It takes about 3 to 4 months for children to come back to the normal nutrition status.